Today I have with me Ed Sorich. Ed specialises in nutritional biochemistry, sports nutrition and is senior scientist from Aquarian Labs in Melbourne. Today we're going to chat about the long-term effect that getting a concussion during sport has on the individual and what changes sports associations need to make to keep us sports stars and kids safe long-term. Welcome, Ed.
Thank you. Pleasure being here.
Such a pleasure having you. And look, so many people are involved in sports and we look at sports as such a healthy pastime to participate in. But ironically, doing competitive sports can lead to injuries that can be detrimental to our long-term health. So what is actually the current standard of treatment around concussion in terms of time off the field, and is it adequate for the player's health at the moment?
Sure. The current standard is, and across most sports, is if it's diagnosed on the day, a player can't return to the field of play.
Yeah. And
then it's mandatory 1 week off the following week.
Okay.
The second part of your question, is it adequate? It's a good question. I don't think we really know that answer. If we have an injury like a knee injury, we know conclusively that a player needs to be off for a period of time. With the brain, it's a little bit more different. So at this point, the jury is out, I would suggest.
So there's been a little bit of talk about this, hasn't there, in terms of...
There's been a lot of talk, and I think a lot of that has been off the back of what's happened in the United States. And what's happened in the United States, for people who aren't up to it, is that ex-American footballers are now sued the NFL.
Yeah.
Putting down conditions like depression, Alzheimer's, Parkinson's, with all the serial concussions that they'd received in the past while playing football.
Okay, and this has happened to a lot of them over there?
It's happened to a lot. The actual numbers, it's hard to actually say, other than to say that out of Boston University and the group with Bob Cantu, Bob Stein, have actually looked at the brains of 100 or so ex-footballers, obviously now deceased, and have proven in nearly 100% of cases that there are markers there or indications there of Alzheimer's or Parkinson's.
Wow. That's quite significant, isn't it?
Quite significant.
So is there, at the moment, you're saying that we don't know if it's adequate or not what the standard is. So what are we trying to do to look into it in Australia?
Sure. So I think like anything else, we tend to follow the Americans in a lot of ways. Sometimes good, sometimes bad. I think if we do follow the American model, I think what we really need to be now proving is, can we get a number on a page? Can we actually quantify concussion? And secondly, how do we implement that in a return-to-play strategy? So the return-to-play strategy is basically to say that when someone is safe to come back onto the field of play. So the best systems we have for that is looking at the blood and trying to investigate quantitative markers rather than qualitative neuropsychology.
Okay, and so that's through X-rays.
Currently, the gold standard, or what is deemed as the gold standard, is imaging. And imaging, unfortunately, for little Jenny or Johnny playing football in the suburbs or even in rural Victoria, is not available, first of all.
Yep.
And then the argument is that actually specific? And the argument would clearly state that it's not. So imaging is probably not the best form of screening, or in fact diagnosis. Neuropsychology to a larger degree, and functional neuropsychology in particular.
Okay, so what does that involve? So
functional neuropsychology is beyond asking players, what game they're playing at today, what their mother's name is, etc. It's putting them through stressful neuropsychology processes whereby, there might be a computer program where they've got to match the dots.
Okay.
They actually, there's another form of functional psychology where they actually use transmagnetic stimulation. So they put a cap on someone's head, they send a signal to that part of the brain, and then they see the response time in the finger.
Okay.
And if there's delay in that response time, obviously there's a problem in the brain area. And that's a lot of work that's being done by Alan Pearce at Deakin University.
Okay, so that's probably something they can do for professional sport, but it'd be probably a bit more difficult, at your child's
absolutely
match.
Absolutely. Like anything, it takes some time for research to get down into the grassroots. But at this stage, really for kids, the answer is they need to go see, obviously, a GP as a first point of call. But beyond that, they have to see someone who's qualified in the area, in the space. And obviously, mum and dad are very powerful in that they can monitor the child. That's what it comes down to.
So are we talking about when somebody gets literally knocked out, or what if they just have a little knock and think it's okay to keep going?
Sure. I mean, that's the classic scenario. People think knockout means sea stars, dazed, vomiting, etc., etc. That's really not the true definition of concussion.
Mm-hmm.
Mild concussion, which we can't pick up, is really the scary place,
Okay.
and really something that is being missed currently.
And that too has an effect, not just the big knockout.
Absolutely. The mild TBI is the one that the people are talking about. The reason being is that because it's not picked up, it's not being treated.
Yeah. And what effect does that have when kids or athletes are going out there and they've had that little knock? In terms of not resting properly,
Sure.
what effect is that having?
So like anything, every injury's recovery is based on recovery. And you're not going to make someone run. The clear-cut example again is the knee. If someone's got a knee reconstruction, they know they're out for 12 months.
Mm.
The problem with the brain is that we haven't made that decision yet. So the argument from the researchers is, well, surely the brain should be treated with more respect than what the knee is.
Mm.
So the problem really then is, how do we put a number on it? And the current systems don't allow us to do that. So in children, the answer is basically that the systems have to be improved. Dr. Rosenfeld, or Professor Rosenfeld, I should say, at the Alfred is a big advocate of basically saying if a child is knocked out 3 times or is diagnosed with concussion 3 times in a year, they should not play for the rest of the year. Okay,
wow. So what would you say to mothers out there that have a teenage son or daughter, playing? If they've had some sort of knock, how should they, treat their child?
Sure. Again, it's really about using the systems that they may have in place. So SCAT3 testing is something that they use on the sideline, and it's probably then used at a doctor's surgery. Again, if they're not happy with the doctor's diagnosis or they're not getting the full answers from their GP, they really should go and investigate and find someone who's a specialist in concussion. And there are numbers of practitioners out there who are specialists in that area.
Yeah.
And then secondly, as I say, parents know their children better than anyone else. So it's really about monitoring the child and little things like, the child's balance. Has the child been affected sleep pattern-wise? Is their eating habits changed? Are their school grades being changed? And this can happen for up to 3 months. So it's not just a case of making sure that everything's okay for a week.
Okay, so it's really something long-term and it's important, isn't it? Because it could affect their health,
Ultimately, absolutely. I mean, if we can go with what's happening out of America, that there is claims that it can have long-term effects leading to Alzheimer's and all the rest.
Yeah.
Now, these are long-drawn claims. We can't really, conclusively say this is in fact the case. But like anything else, we need to be looking at prevention rather than cure. And if we can control it even for a short period of time, monitoring a child for a couple of weeks is not a bad thing.
No, especially when it's your child. It's, one of the most important things
absolutely
you can do. And I know you're very involved with trying to get the standards changed for concussion and trials and everything. Can you tell us a little bit about that?
Yeah, again, in the States, we're a little bit behind, and most recently visiting Harvard University and a couple of biotech companies in the US. Ashamedly, we are a little bit behind in this space. So we're looking at doing a couple of clinical trials, one hopefully in the very near future in the next couple of weeks.
Okay.
With the professional footballers or soccer in the Australian term out of Melbourne. And that'll be pretty well groundbreaking. We'll be trying to introduce those markers into that trial and comparing against what is now deemed as the gold standard, which is essentially neuropsychology and imaging. Then going forward, obviously then going into larger scale trials.
Yeah.
And we have to realise that this is only a small part of the problem. People in the ER departments at all our hospitals deal with this week in and week out. So really, sport is only a small issue here. It's really a larger problem that it's happening in our ER departments.
Wow.
As we speak.
I think it sounds very interesting, and there's some really good tips there for people to monitor their children, especially, or their partner, or whoever it is that is playing sport. If people want to find out more information about what you're doing, where can they look?
Sure. We've got a website that people can hook up to. It's www.concussiontbi.com.
Beautiful. Well, thank you so much for coming on.
Thank you.